Thank you, Shireen, for inviting me, and good afternoon, everybody. So, I guess after demographics and training, we are now on to standards. So, which I believe would be the natural fallout if all what we have discussed, standards would be the natural fallout of as we go along. So I'm going to speak on standards, and as the title of the slide suggests, is going to be the case history of India. I know we are not in the MENA region; we wish we were, but we are within the global world, and so I'm going to speak on standards on mandatory minimum, preferred minimum, and aspirational standards, which at this point of time I have leading and navigating in this country. Uh, the benefits from standards. Now, the benefits from standards, of course, is to industries get self-regulated. This creates a development of consistent quality, safeguards residents, and gives us a benchmarking for the industry. So that the senior living provider, that is the people who run the industry of senior care, can reduce inefficient practices and promote a proactive approach to problem solving and help justify a higher value and price based on level of certification. This of course drives efficiency and cost savings, promotes innovation and continuous improvement, and their continued engagement with family, community, business, and culture beliefs and younger people through these standards. This facilitates and promotes self respect and empowerment of elders because the standards are built in basically for resident engagement, keeping as the North Star when we write the standards. These are also reporting protocols. It facilitates the burden on governments and to regulate and to monitor. Because when the industry self regulates itself, it takes care of all the the stick formula, and the industry satisfies also legislative requirements, if any, and in participating providers of the industry evolve to improve the collective quality of their product, function, and most importantly, the resident experience. The standards cover 8 aspects of the senior living community. They are, uh, as it can be seen on the screen, classified under governance, management and personal, design and construction, facility management, home care and additional service, resident engagement, technology and information, and hygiene, safety, and prevention. All these are very broad categories, and these under these categories are dovetailed individual standards under these categories, which adapt. I mean, at least for India, focusing on cultural sensitivity, best practices, local norms, local ethos, contact, country values. Government regulations are also dovetailed inside there. Operational, legal, financial, and geographic requirements. So all these are very unique to every country. And when we realize that these are the broad 8 categories, the other application that I just spoke to you about on cultural sensitivity to geographic requirements can not all have to be paneled inside these 8 categories for it to be really effective. What are the advantages of accreditation standards? Obviously, an emergent need for a commercial, viable, and professionally managed retirement housing communities is the order of the day, as can be seen across what the morning today that we saw of the protocol of demographics and the rising senior elderly population. Which also brings us to the point of abuse. Just something that we need to be careful about. Elder abuse, ageism. Seniors are likely to be vulnerable for harassment, and there could be breach of contracts and violation of the basic rights. So that's all the reason that we have an acute need for a standard and accreditation metrics and certification. either endorsed by the government or by a local or global industry association. At this level in India, we're trying to do it at the association level of firstly. It already has been submitted to the government, but that has yet to come in. But at this point of time, we are trying to self-regulate ourselves so that there is some sort of a semblance of an envelope created for the seniors. Uh, the standards, as I was again referring to the India case study, are two types at this point of time in India. We have got what is called the minimum standards and the aspirational standards. Now, the minimum standards is mandated by the government. I was appointed as the chair of their empowered committee to formulate the minimum standards for the government of India. While at the same time, I'm working on an aspirational standard model, which also has been accepted by the government of India, which is for an higher aspiration level, which a line of sight of increasing the quality of an individual community or care at home by increasing the standards in a manner which is on a step up basis, not necessarily the minimum standards. The, the key features of the minimum standards are it it's listed as minimum mandatory and preferred minimum. Now I'll explain this anomaly of this preferred mandatory minimum, preferred minimum a bit later. But both these standards, preferred and minimum, mandatory minimum, follows a system-based approach that requires an evidence of documenting, implementing, communicating, improving, and reviewing systems. It has a built-in system-based approach. This has criteria that includes, as I was saying earlier, minimum mandatory, which we feel is the minimum requirement for any senior community. We have to be mindful here as I go along is that this is a situation where there is minimum funding available from the government. There is senior homes across the entire ecosystem of care, and some of the homes are absolutely bare bones minimum. So we have introduced so it can become acceptable and the threshold level becomes easy, a minimum mandatory and what we call a preferred mandatory, also at the minimum category. And above all that is going on to a higher socioeconomic strata, if at all, I mean, the community prefers and the operators want to go for is an aspirational line of sight for higher standard, which are much higher than the minimum. The minimum mandatory standards accreditation matrix is in front of you. So we have criteria points which are needed as per evidence and criteria that have been met, and then there is preferred mandatory, which also have criteria points which has got evidence and criteria, and then the grading takes place. So in our opinion, a minimum of 109 points, which is absolutely really the bare minimum, is what is required for any credible senior living community. Now, as I was telling you that I explained to you a bit further, the minimum mandatory and preferred is, as I told you, is basic levels. The higher level operational standards are on 4-level hierarchy. They have a standard and its intent. Now, this intent is followed by multiple criterias, which is required to be met to achieve the stated intent. The criteria are further broken up into smaller indicators or objectives, which are required to be met by measurable and current examples of evidence. It sounds and it looks complicated, but it isn't. It's an extremely process-driven, step-by-step evidence collecting criterias, whereby if it has to be just checklist and you realize that we have met most of the criteria and evidence that makes up a really good working senior community. The initial desktop assessment and review is followed by an on-site assessment, which is triangulated with documentation, interviews with residents, and practice, which is observed on site. Now, the interviews with residents is extremely important because, as I keep saying, that these whole standards are designed for a resident experience objective. Uh, to help industry meet the standards, we have also come up with some sort of a guide to assist organization in completing the self-assessment and collating and developing evidence so that it does not get overwhelmed on how one can reach the objective of an assessment is helped through a guide process. This is how the accreditation metrics of a aspirational standard looks like. If you'll notice, there are three categories: silver, gold, platinum. The points have jumped from 109, 54 to 282. Even 85% of the maximum 282 points would be good enough for a platinum accreditation. Since we launched it 3 years back on a pilot project, self-regulatory basis, excuse me, two of the communities in India have been accredited with platinum rating and which was accepted by the government of India. Uh, the our recommendation for implementing of minimum standards would be that to ensure the standards are implemented effectively, and please keeping in mind that there is significant diversity in facilities with respect to purpose, breadth of service, target user ownership. Please appreciate that when we are trying to implement minimum standards in India, we are doing this on communities which are run by government funding, run by government itself, and also complete NGOs with very little funding coming in otherwise from the seniors themselves. So with the minimum funding that we have, that we can get from the government and from private enterprises, these standards are being implemented on such homes so that at least there is some sort of an baseline usage for such homes. The guiding principles, again, we submit, as I said, 2 tiers, which I said I'll speak to you about earlier, is this essential minimum standard, as we say, which should be met by all facilities, irrespective of their type, price, target users, and the desirable minimum standards, which should be met by new greenfield facilities. The public government support, we feel, should be enhanced for qualifying facilities, meaning desirable standards, and initiate schemes for facility to upgrade from EMS to TMS, and so that more capacity is reached with facilities which are at least in the minimum desirable or what we call preferred minimum standards. The other recommendation we have is that all senior facilities, as I said, should register with the concerned department. There should be an independent QCI or a quality control investigation agency for managing standards. At this point of time in India, and since I'm been asked to speak on the India case study, we are pushing to with the Indian government to create a system whereby a lead association like us or any other association which they would like can be created so that the minimum standards that are there are accredited by them. And of course, transparency has to be maintained so that there is ultimately the better care for seniors. And the voluntary accreditation process can be achieved if there is an hand-holding by the government and support by the industry to create this bare minimum standard as a model. Our pilot version was introduced on the 22nd of January 2021. And as I said, the aspirational standards, 2 certificates were given to on 16th of June 2022, in 1 year's time, by the Government of India, by the Ministry of Social Justice and Empowerment, to 2 communities which were handed over platinum grading. The On 7th of November 2021 itself, again, my committee submitted our minimum standards, and which I said the bare minimum and the mandatory minimum standards to the government of India, and further communication is awaited. I am being mindful of the time, so I have been, I have tried to rush it through, but I'll be more than happy to answer any questions now, later, by email.